Why do diverticulitis abscesses recur after drainage? Imagine battling an infection that keeps coming back despite treatment. That's often the case with diverticulitis abscesses. When an abscess forms in the colon due to diverticulitis, doctors may drain it to relieving symptoms and control infection. But why do these abscesses sometimes come back even after drainage? Let's explore the reasons behind this. First, drainage usually removes the pus and reduces pressure, but it doesn't always eliminate all the infected or inflamed tissue in the affected part of the colon. Some bacteria or inflamed tissue can remainges, which may cause the abscess to reappear later. Think of it like cleaning a spill but not removing all the dirt. The problem might come back if the root cause isn't fully addressed. Next, diverticulitis is a chronic condition that involves ongoing changes in the colon wall. Even after draining an abscess, the diseased segment of the colon stays vulnerable. The weakened wall and persistent inflammation can lead to new episodes of infection and abscess formation over time. This natural progression of the disease means that drainage alone often doesn't stop future problems from happening. Sometimes, complications like fistulas, abnormal connections between the colon and other organs or the skin can develop. These fistulas can serve as pathways for infection or abscesses to recur. While fistulas can form as part of the disease process itself, they can also be related to the drainage procedure, especially if the infection is severe or long-standing. The size and location of the abscess also matter. Larger abscesses or those in tricky spots like the pelvis can be harder to drain completely. If some infected material remains, it can cause the abscess to come back. However, studies show that location alone isn't always a clear predictor of recurrence, and other factors play a role. A person's overall health and immune response are important too. Someone with a weakened immune system or other health issues may have a harder time fighting off infection, increasing the chance of recurrence. This means that individual factors can influence how well someone recovers after drainage. Finally, drainage is often a temporary fix. It's usually used to control an acute episode and buy time for more definitive treatment. Many patients need surgery later on to remove the diseased part of the colon. Without surgery, the underlying problem remains, and the risk of abscesses coming back stays higher. Research shows that after drainage, about 20 to 50% of patients experience a recurrence. To reduce this risk, doctors often recommend elective surgery to remove the affected colon segment. This approach addresses the root cause and helps prevent future abscesses and complications. In summary, abscesses tend to recur after drainage because the procedure treats the immediate infection but not the underlying diverticular disease. Persistent inflammation, incomplete removal of infected tissue, and the chronic nature of diverticulitis all contribute to the chance of recurrence. Drainage is a valuable tool for managing acute episodes, but often it's part of a bigger treatment plan that includes surgery. If you or someone you know is dealing with diverticulitis, it's essential to work closely with healthcare professionals to develop a personalized plan that minimizes the chances of future problems.